The importance of single embryo transfer cannot be overstated. Having a healthy mom and a healthy baby is best assured by putting one embryo in any one effort to become pregnant. Now, historically, 20, 30 years ago, 3 or 4 embryos were put in at a time and put in an early stage of development. But our laboratory technologies have improved so much that we can watch embryos grow to 5 or 6 days, we can do genetic screening, other aspects where we have greater confidence that any one embryo can lead to a healthy baby. So overall, if I were to look at our patients in terms of outcome, any one embryo probably has about a 40% chance of success. Now, among older women with diminished reserve, severe sperm issues, that isn't the case. But overall, that is the case. And if we look at our center in general, we do at least 50% or more single embryo transfers, leading to very good outcomes. And we see about a 50% pregnancy rate overall in our practice with fresh embryos, and about a 58% pregnancy rate with frozen embryos. So being able to keep our pregnancy rates stable while putting less embryos in reduces the risk of multiple birth. Colleagues in our field around the planet in the United States have done a very good job in putting less embryos in. The guidelines by the American Society for Reproductive Medicine have been helpful, and we've been encouraging everyone to do that. The outcomes reported by the Center for Disease Control have shown a marked decline in triplets and quadruplets, but the downward pressure has still left a transition to more twins. Instead of the triplets and quadruplets, they're now in the twin category. The problem is the complications with in vitro fertilization are primarily in the multiple birth category, because the more babies in the womb at one time, the greater the strain for any one fetus to develop properly, and they may slow down in their growth, or mothers to get sick with diabetes in pregnancy and high blood pressure, preeclampsia, causing an obstetrician to have to deliver the baby early because the incubator down the hall at the hospital is now better than her incubator because her placentas aren't working well. So we need to avoid the complications that come with multiple birth and premature delivery. And to do that, one embryo at a time is the key. And without having a reduction in outcome with frozen embryos, the pressure historically to put more back at a time is completely relieved. So there is no good excuse in this day and age to not be able to encourage your patients and guide them to a single embryo transfer with wonderful hope for success.